The services available to families have grown since years before us. In 2007, ACS formed the Community Partnerships to promote children's safety and strengthen the community's ability to keep children safe and support families. The Lower East Side Community Partnership currently serves as the liaison between ACS and the Lower East Side/Chinatown community.
LES Community Partnership has existed since 2007, and it's a coalition of 40 different organizations. We have representatives from University Settlement. We have representatives from Chinese American Planning Council, Catholic Guardian Society and Home Bureau, which is the main foster care agency assigned to the Lower East Side. And it's through this coalition and through this governing structure that we can determine how we can support families here in the Lower East Side the best we can.
The resources come from the school, the family court, hospital, and the other community organizations, such as the mental health agency, the child care agency, and also ACS.
A very important partner in the work of the community partnerships is the participation of the preventive service agencies. These are agencies contracted with ACS to work with families who are either struggling or just in need of additional services.
The preventive service is foster care and adoption preventive program. And we provide a lot of different services to meet the family's need. And in our agency, we provide a lot of service to, we target the Asian community and family and the children. Preventive service include case management, case planning, and casework contact. They are include crisis intervention, individual family counseling, parenting skill training, community advocacy, education information, referral.
YMCA's preventive program is designed for the family who in need, and then we help them. Of course, the goal is for the safety issue. The main goal is to keep the family together and the safety, the children's safety.
Needs and concerns can be resolved early on so that they do not escalate into a much bigger crisis. Families also know that they have a place to turn to when they do not know how to seek help.
Okay, usually if a client comes to request a service and we have an intake worker, the intake worker usually be me or other senior case planner to interview the family and discuss more about the family situation. Then we have to assess what kind of service the family need, and then I had to explain to them about the procedure, the requirement in order for us to open the case, and how we discuss as a case worker or intake worker, we had to discuss with the family what we can offer, what we cannot offer. If the service that we cannot offer, and then we will refer them to other service.
The Chinatown YMCA, basically the YMCA have different kind of program, like the child care service, the teen program, the family service. So at the time the client receive the service of our program, we will refer them to the different kind of program if they need, such as the child care service and the teen. We will let them know what kind of service the Chinatown YMCA can provide to them, just connect them to the YMCA service.
LES Community Partnership also promotes collaborations between these different community-based organizations so that families are provided the services that they need.
So she doesn't have it. Ask the hospital.
I come in at 8 o'clock in the morning. I greet the parents and the children. Love what I do. I know the families. I have this connection and I talk to them every day. So if the parents having a bad day, you can normally tell by their facial. I ask them if they need anything. I do referrals. If the child needs updated medical or dental, of course we go through the files, because the files is ongoing process, not just something that goes. I also let the parents know of what's going on in that week. If we have a training, we have a workshop. I also give them information of any new resources that's coming in the neighborhood, any new classes that they're interested in, because I do a family partnership with them, and it lets me know what is their goal. So this is, so I help them also with their goal as well. And I also do home visits for the prenatal moms, give them support. I also give them information for them to attend prenatal classes to prepare them for their newborn. I help them if they need work, or with them to help them to the process of getting work. So yeah, it's love what I do.
Families now have a place to turn to when they are struggling, and organizations who serve Lower East Side families have a resource center that they can rely on when they identify families who are in need.
My position here at the Education Alliance, I have a caseload of 45 children. They're from the ages from prenatal to 5-year-olds. I do referrals, workshops, trainings for the families. I assist them in any situation that they need, guide them and support them.
When it's appropriate for a service provider to refer a family to a preventive, I think when there's a sign of a child abuse and neglect, such as the children come to school with the dirty clothing, feel that the parents might not meeting the child's basic need at home. The child comes to school may be hungry, and the parent has difficulties to struggling in dealing with the child or the children. It's also aside from the child indicate that there's a domestic violence at home that could harm the children's psychological and well-being, or the parents' ability to provide adequate supervision to the children. And also, we look at the caretaker's mental health and physical health, whether or not it is caretaker capable to taking care of the kid or ability to protect the child. So if the school or other service provider observe all those symptoms, they can make a referral to preventive. The preventive worker will do assessment. We also we do home visit and to assess the family situation.
Well, we serve the Chinese population. There's like two different cultures. Like in China, in the Chinese culture, corporal punishment is very common. You know, if the child disobey to the parents, like it's okay to be, have the corporal punishment in China. But right here, at the time they come to the United States, they have to learn the new form of discipline. So that's why, we have to educate the parents about the cultural differences. So it's not allowed to conduct the corporal punishment to the children in here. Even we are located in the Lower East Side area, but our service is citywide, outreach to the Bronx and Queens, Brooklyn. And like we serve the Hispanic population, Chinese population, and also we have some of the African American population too.
Hi, my name is Florina Hicks.
My name is Johnny Johnson. We're community reps with the Lower East Side Community Partnership.
Community reps assist families in need of services. They provide resources found in the community and act in what is the best interest of keeping children safe.
Every 6 months we have a family team conference, and the family we invite ASSP participate, and the same thing at the CBI representative needs to be present. The family can also invite their the friends and relatives. They can be supported and know about the family situation to get their support. And as a team, we come in to talking about why the case will come to us, or what are the things that we have been done to help the family, what are the things that we feel that as a preventive worker they still need to work on, but we also get the feedback from other family members and to give the input on our service, on the progress they make, on the barriers they still are struggling. As a team, we come in to talking about what else can we do to help the family better.
We represent the community, with the ACS, we support the ACS process in terms of preventive measures for parents who find themselves in a situation where their children are being threatened.
I always introduce myself, and I always try to make them feel real comfortable and just let them know that I'm here to support them and whatever mistakes they did make in the past. And now, we're going to work on some new solutions and some new issues that we're going to try to move forward to.
I see an impact in the community because some of those parents that would have otherwise lost their children, it's like a wake-up call, the counseling that we provide, the resources that we provide, to strengthen them, to get them to see the situation where they are. And once they see their situation, they're more readily agreeable to get the services that they need.
It was a mom and she had 3 boys, and she was strung out on drugs. So I was outside and I was recruiting, walking around the neighborhood, and I told about the program we had there. And it's interesting, the parent didn't know about the services, and meanwhile she was right across the street from me. So I brought in the 3 kids. I helped her to get the 3 kids' birth certificates. I got her into a drug rehab program. Her mother stepped in, gave her support. They came on the New York Times, Most Neediest. They also got money to help her. I'm happy to say for the past 10 years she's been drug-free and the children still visit me.
This resource exists, and that if you notice any concerns with any particular family, please notify our network immediately before it escalates into something much worse.
That's our goal, to have the family stay together.